particularly a health service at the current time as well. Let's talk to Chris Hobson. He's Chief Executive of NHS Providers and joins us now. Good morning to you, Chris.
Good morning, Julia.
Good morning. Good morning. Let's talk about the threat that we've got to the NHS right now. We are in winter. We know that there is a winter crisis pretty much every year, and we know what it is. We've got fewer doctors, nurses and hospital beds per person in the country than most of our Western European neighbours, and that does lead us to have that problem every year. Is the winter crisis this year any worse than any other year?
Julia, that's a bit disappointing, if I may say, because I was hoping that after the interview that we last did on December the 17th, you'd actually start by apologising for how you conducted that interview.
Really? Why?
I thought you might want to apologise to the hundreds of thousands of NHS staff who you said at that point or implied weren't that busy. I thought you might want to
didn't say they weren't busy.
No, you did, Julia. You actually did. If you go back to the interview on December the 17th, you used two anecdotes where you effectively said, oh, I've been talking to people who say the NHS isn't that busy.
But I asked you questions on the basis that we're told, you were saying that the NHS was overwhelmed.
You used the last word to basically imply that the evidence that I was giving you, that things were getting really quite serious and that the NHS was getting really busy, you effectively used the last word to imply that I was effectively in the NHS was crying wolf. So I just think it would be really good if, given that you have been using your platform over the last few months, dangerous day after dangerous day, to basically provide deliberate disinformation and distortion, if you just recognise what's actually going on in the NHS at the moment, and that effectively you recognise how busy the NHS is, and you recognise how serious this has now become.
Okay, I'm not going to apologise for asking questions and for putting alternative points of view to you. No, I'm not, sorry, Chris.
So I think there's a real difference between, as you and I both know, between objective journalists, as Nick Robinson was doing with me on the Today programme, asking probing questions to uncover the truth.
I don't work for the BBC.
Like you,
Chris, I don't work for the BBC.
Peddling disinformation day after day. And I want to say to you that the trust leaders that I now represent are really concerned that people like you and fellow anti-lockdown ideologues like you are effectively running down the NHS and running down the work of hard-working frontline staff working under impossible conditions.
Chris, you've had your say. Let me have mine back. I don't work for the BBC. I am allowed to give my opinion. I'm allowed to put my point of view. One of the things that Talk Radio is doing, which no other broadcaster is doing, is questioning a lot of the narrative. And I've got lots of questions I'd like to put to you, rather than we just talk about me. Chris, could I please finish at one point? Chris, okay, should we just take the microphone down so the listeners can hear me as well as you? You've just accused me of peddling disinformation. Now, I'm sorry, I'm not causing a danger to anybody and I'm not running down the NHS, and certainly not any of the NHS workers, who include my own family members, by the way. I'm not doing that at all. What I'm asking you is whether or not things are any worse this winter. We have a winter crisis every winter, and we shouldn't do. Whether it's any worse than it normally is. Do you want to answer that question or not?
Yeah, of course I'll answer it. I'll just say first though, Julia, that informed dissent, evidence-based dissent is one thing. I think spreading disinformation and distortion.
What disinformation? What disinformation have I spread?
Is very different.
What disinformation have I spread?
Answer to your question. So I'll answer the question now. The answer to your question is yes, this is very different. In the words of a chief executive in the south of England who I was speaking to yesterday, this is the most pressure that they have seen the NHS under in their 40-year career. So despite the fact that you were trying to say to Layla McKay on Tuesday from the NHS Confederation that you were implying to Richard Vaughtry from the BMA yesterday that actually the NHS wasn't that busy, if you bothered to look at Fergus Walsh's report on the BBC last night, you will have seen that the NHS is under absolutely enormous pressure. And the issue is that you consistently use your interviews to imply that actually the NHS isn't that busy, to imply this isn't that serious, to imply that, for example, PCR tests are consistently inaccurate, to imply,
I've never said they're consistently inaccurate. You're just completely making things up. There is an issue with the accuracy of PCR tests that has been acknowledged by large numbers of people. Like you accuse me of peddling disinformation. That's a very, very, very serious charge. Right, I'm going to go through some of the things. The reason why a lot of people like me, it's not because I'm ideologically opposed to the NHS. I'm the daughter of an NHS GP, for goodness sake. It never occurred to me to question what health professionals, scientists and medics would be saying until we were into rather late stages of the first lockdown, when a lot of the things we were being told were starting to worry me about whether or not they were whether or not lockdowns in particular are a proportionate response to the threat we face. I'm not pretending for a moment that we don't have COVID patients, that COVID isn't deadly, never said it's a hoax, never said it shouldn't be taken seriously. I obey all the laws, I socially distance, I wear my mask. I was doing the social distancing about a month before we were told to do it because I'm sensible. We had a COVID pandemic. The question is whether or not the NHS is under any greater pressure than it normally is. When we look at the mortality data, now the absolute objective data, no one can actually fix that data. The number of people who are dying in this country at the time, we are seeing more people dying at this time than we normally do over a 5-year average. However, it is not particularly unusual if you look over a 20-year period. If we are in the middle of a huge second wave of this pandemic, would we not be seeing higher numbers of people dying right now? Chris Hobson.
So Julia, what else? I mean,
Are you going to answer the question, or do you want to just keep accusing me of lying? It's a reasonable question, isn't it?
It's a perfectly reasonable question, Julia, but it's very, very clear if you talk to everybody in the NHS that we are seeing very large numbers of people coming into hospital with COVID. We've had 10 full hospitals worth of COVID patients over the last week. That's 5,000 people.
People testing positive for COVID.
People testing, and again, you
not necessarily COVID patients.
Do this with the NHS Confederation on Tuesday, implying that
not implying anything. We don't. No, when you say COVID patients, you mean patients who have tested positive for COVID. They are not necessarily being treated for COVID. That is a simple matter of fact. It may be 1% of them, it may be 99% of them, but we don't know because those figures aren't made public.
They are occupying an NHS bed, which basically means that we are now coming under.
But if they're in hospital for another reason, regardless of the COVID pandemic, they would be in a hospital anyway.
Would you like me to answer the question or not?
I'm explaining to you the context of that question.
Yes, and what I'm saying to you, Julia, if you'd let me have a word in edgeways, is that effectively we've got 5,000 fewer beds than we had at this point last year, and we've now got nearly 29,000 of those beds occupied by patients with COVID-19. We have seen, as you saw from Fergus Walsh's report on the BBC last night.
Sorry.
Well, okay, but Julie, with the greatest respect, if you want to start questioning people and arguing the kind of things that you're arguing, you really ought to watch what's actually...
Oh, I'm so sorry. I'm now required to watch the BBC's report before I'm allowed to ask you questions.
No, you might want to inform yourself about the reality.
Inform myself. Okay, let me inform myself. Okay, let's look at how bad things are right now using objective data. Not your opinion, not what I say, not what an NHS executive says. It is a simple matter. A&E attendance in England, looking at it all the way to the end of December, is for acute respiratory infections, is flatlining and way below the normal baseline for a normal winter. Influenza-like illnesses reported. These are official data, Public Health England data, their own graph, flatlining, way below normal levels. Reports of daily number of attendances recorded as pneumonia, flatlining, way below the baseline. I've got these in front of me. Even 999 calls for COVID-like symptoms, largely flat, slightly rising now, but largely flat since spring. A little bit of an uptake in the last few weeks. The excess mortality figures. We are seeing more people die. 1, because it's winter. 2, because we have COVID. But the numbers of people who are dying as in excess, the total number of people who are dying in this country at this time of anything at all is nothing like where we were with the spring pandemic. What I'm saying is where is the, other than the PCR test, where is the objective data proof, as opposed to what someone is saying, that the NHS is being overwhelmed with a number of COVID patients who are then possibly going on to die, when all of this other data says something different?
We can all quote data. Julia, I can quote at you the 5,000 people who have tested extra patients who've got COVID-19, who've come into hospital over the last week. That's 10 full hospitals full of new COVID patients.
Full of new patients who had tested positive.
1,000 people died from COVID. Yes, reported was dying from
COVID.
COVID.
Oh, Chris, now you almost made a mistake there. That was disinformation, wasn't it?
COVID over the last week. And Julia, hey, what next? I mean, yeah, of course you could argue that they've been misdiagnosed by hundreds of doctors up and down the country. So what's next?
I haven't
Is
argued
Elvis
that.
still alive?
I haven't argued that.
What's the moon shot? Was the moon landing recorded in a NASA
The only
warehouse?
person, Chris, I mean, genuinely, Chris, you've been a guest on my show for very regularly on the last year. And I'm genuinely embarrassed for you. Not only have you basically libelled me, peddling disinformation. I have not peddled disinformation. This is an Ofcom regulated channel. If anyone wants to make a complaint about anything said, it will go to Ofcom and they will make a ruling after the evidence is put on both sides. And I can absolutely assure you, we've never had an Ofcom complaint that's been upheld against me. I think that's an incredible allegation. Most of what you just said was basically comparing someone questioning official claims of the crisis, someone questioning lockdown policy as the equivalent of claiming that Elvis is living on the moon. I'm sorry, I find that offensive.
Well, sorry, Julia. I wanted you to know that lots of people, the trust leaders that we represent, are finding the activities of anti-lockdown ideologues who are going around and filming in hospital corridors.
Never endorse that.
Basically show, and I'm not saying you're doing that, I'm just saying that who are effectively trying to...
What's that got to do with you accusing me of peddling disinformation?
Yeah, and Julia, because I'm wanting to say to you that trust leaders that we represent and others are effectively saying that there is now a real danger that people who are challenging what is going on in terms of, for example, the lockdown, are risking the ability to reduce the number of cases.
Wait a minute, so me, in a free democracy, we've still got some semblance of freedom of speech left. Me questioning government policy, questioning whether it's the right policy when it's been proven, even in reports published in the Lancet. I think you assume that you'd agree that the Lancet is a reputable publication, peer-reviewed, showing a document showing that actually there is no correlation between lockdowns and cuts in mortality per capita in across the world. Even questioning that is somehow causing the NHS to be overwhelmed and more people to die. How dare you question people's right to freedom of speech?
I'm saying informed, evidence-based dissent is absolutely, and questioning and holding people to...
So I've cited a document in Lancet, and I've cited PHE, Public Health England statistics, and you're accusing me of peddling disinformation. Who the hell do you think you are?
Julia, can I get a word in edgewise? Can I respond?
Yeah, go on. Why don't you libel me again? Go on.
Thank you. Informed, educated, evidence-based dissent and scrutiny,
what we do here,
is of course really important. All I'm saying is that we are in the middle of a global pandemic, and it's really important that everybody who has a position of authority like you do and who commands respect on the airwaves effectively does not use that position to effectively put across distortions and disinformation.
I've never done that. If you'd like to put in a formal complaint to Ofcom, you are entirely entitled to do so.
All I'm saying, Julia, is that what's been happening over the last few weeks, over the last few months, is you have been picking up individual bits of information and effectively you've done it 3 or 4 times this week already. All I'm saying is you just need to talk to frontline NHS staff.
I do, Chris. They get in touch with me and I verify who they are, and they tell me that we are not getting the full picture.
And what we're saying is that the NHS is under a degree of pressure that it's never been before, that this virus effectively spreads through social contact, and that
25% of cases happen in hospital.
I finished. The only tools that we have available at the moment in terms of restricting that social contact are to put the measures in that we have in place. That is what is needed to ensure that lives are saved, to ensure that patient harm is reduced, and to ensure that the NHS can treat all the patients.
Chris, we're going to have to leave it there. I've missed the news. The poor newsreader didn't sit there waiting to listen to the news. I've missed out another guest. We're going to have to squeeze that in. I'll just say to you, just finally, that genuinely, if you really want to reduce patient harm, it'd be really useful if 25% of patients in hospital didn't catch the virus in hospital, which is what official documents suggest is what happened, because Carl Hennigan at Oxford University, from his analysis as well, is now widely accepted. Nothing that I have said or any of my guests have said here on Talk Radio or what I said to it has ever once questioned whether COVID is serious, has ever questioned whether people should obey the law, whether people should social distance, or whether they should wear their mask as they are legally required to do. And I think, frankly, it's an absolute outrage for you to basically say that people should not question government policy and what NHS executives and like are saying, when we are looking at it based on evidence which the NHS, the government, the ONS and Public Health England themselves put out. I do hope you come on again, because I'm very happy to have a robust debate, but I'm not very happy to have someone like you come on and accuse me falsely of peddling disinformation. If you want to put a complaint in, put a complaint in, stand by your complaint, or take it back. I'll look forward to talking to you next time. 9:43 is the time. This is Talk Radio.
Online, on DAB, and on the Talk Radio app. Talk Radio.
Get revved up for a new kind of chat.